Bismillahirrahmanirrahim. Now comes acute inflammation. We know that acute inflammation is basically the rapid response to inflammation, rapid response to injury, and it involves basically 3 to 4 major steps. First one is that if this is a blood vessel, it will lead to vasodilation. First step is vasodilation. You can see that the blood vessel is dilated now. Then what happens that the leukocytes, mainly neutrophils and the macrophages. Neutrophils and macrophages are the main leukocytes because they have the capability to engulf the microbes. So the neutrophils and macrophages, they move out of the blood vessel membrane due to increased permeability, and these neutrophils and macrophages then move to the site of the injury, and this will be explained later in detail. Now we are going to study the first step of acute inflammation, which is the reaction of the blood vessels. How will the blood vessels will react? So the blood vessels react in two basic ways. One is the changes in the vascular flow or the blood flow, and number two is the changes in permeability. So first of all, we are going to study the flow, the changes in the flow. So what happens that if this is a blood vessel, histamine is released, and histamine acts on the vascular smooth muscles, and this will cause the vasodilation of the blood vessel. As you can see, the blood vessel has enlarged, and not only vasodilation occurs, but also small new capillary beds form. The blood vessel proliferates and new capillary beds are formed, and obviously this will result in increased blood flow. The blood flow will increase, and more and more heat will be produced. This is basically the cause of heat at the site of injury, and redness will also occur over there. So this is basically the cause of heat as well as redness at the site of injury. Then what happens that vasodilation is quickly followed by the permeability. Then after vasodilation, what happens that the permeability increases. Permeability of the blood vessel increases, and the exudate, as discussed before, the exudate, the plasma and the plasma fluid and the proteins move out of the blood vessel. And then there will be, obviously after the release of or the loss of exudate, there will be extreme loss of fluid. Now you can see that there is extreme loss of fluid. More and more fluid has gone. So now this is the blood vessel which has very less fluid, as the fluid has flown out, and it has now very less proteins and very less red blood cells, also white blood cells also. Now what will happen that stasis, temporary stasis will develop. Stasis means that there will be normal or slow blood flow, and what happens that the red blood cells are smaller in size. So the red blood cells move faster than the white blood cells. So as the red blood cells move faster, the white blood cells are pushed to the periphery of the vessel wall, and these white blood cells or the leukocytes, they move to the periphery and they attach to the periphery, which and they migrate to the interstitial tissue. Now comes the increased vascular permeability. Increased vascular permeability is basically due to 3 reasons. Number 1 is the retraction of endothelial cells. Retraction of endothelial cells, it means that the endothelial cells, let me explain it with the help of diagram. It means that, for example, these are the normal, this is a blood vessel, and these are the normal endothelial cells. So these endothelial cells almost have no space between them, or very little space between them. Now what will happen that these endothelial cells will move further away from themselves, and they will create spaces between themselves. So spaces are created between the endothelial cells, and the fluid and the protein and the cellular the vessel content will move out of the blood vessels. And this is basically elicited by histamine, bradykinin. It happens due to histamine, bradykinin, as well as leukotrienes. Leukotriene, LT means leukotrienes, and it occurs within 15 to 30 minutes of injury. And it is basically short lived. It does not long very for a very long time. And the main site of the retraction of endothelial cells is post capillary vanules. Post capillary vanules are basically the basic sites where this process occurs. Now comes the endothelial injury. Endothelial injury is basically that whenever burns occur, for example, this is my skin and burn occurs over here, then obviously all the skin and the cells and the endothelial lining will be destroyed. So what happens that in case of very we can say very dangerous microbes, or in case of burns, etc., these endothelial cells are destroyed. As you can see that they get destroyed, and after destruction, the fluid of the vessel and the fluid flows out. And neutrophils also damage the endothelial cells, so endothelial necrosis occurs, and this happens in severe injuries. So this also increases the permeability of the vessel. Now lastly, what happens that there is a process which is called as transcytosis. Transcytosis is basically the increased transport of fluids and proteins. So what happens that in transcytosis, there are some channels in the membrane, intracellular channels, which respond to the vascular endothelial growth factor VEGF, which promotes the vascular leakage. Let me explain it with the help of an example. Like for example, this is the membrane, and this is the transporter. These are the intracellular transporters. So what happens that whenever the VEGF, which is the vascular endothelial growth factor, comes, it is recognized by this transporter. And now what happens that in response to this this VEGF, the permeability will increase and more fluid will flow out of the vessel.